Okay.
Perfect. Good evening, everyone. Hello and welcome to Reimagining Healthcare in the Post-COVID Era. This is a series of live webinars for key stakeholders in healthcare. To introduce myself, this is Ariman. I'm the co-founder and director at Praxis Global Alliance, and I'm also the leader of the healthcare vertical within Praxis. I'm joined today by Madhur, who's my partner and MD at Praxis. Praxis is a leading management consulting and advisory firm. We've established a strong presence in India over the last couple of years, and healthcare is a very important vertical of our business. We kickstarted a series of focused webinars in the healthcare and even other verticals as we speak. And we are excited to host you in this unique platform where our sessions are actually aimed at answering critical questions, discussing emerging trends, opportunities, and the following strategies to succeed in the new normal post-COVID. For healthcare particularly, we are kicking off this series with today's session around reimagining healthcare in the post-COVID era. And our next set of webinars will deep dive into specifically delivery, health tech, diagnostics, and medical devices. Today's session, we'll focus on striking a balance between what has worked well in the past versus now what needs to happen in the future in the new normal to accelerate success for healthcare sector to get ahead of the pandemic crisis, while continuing to keep patient care as the unified vision of the entire ecosystem. It will cover the impact analysis of key challenges due to COVID, its outlook, and strategies healthcare enterprises can adopt to actually get out of this crisis. To start off with, it gives me immense pleasure and pride to share with you that today we have a panel comprised of very eminent industry personalities and leaders who've shaped the Indian healthcare ecosystem. A few words which I might share might not do justice to all the accomplishments in healthcare, but I will try my best to summarize that. So joining us this evening is our keynote speaker, Honorary Brigadier Dr. Arvind Lal, Executive Chairman and Managing Director at Dr. Lal Path Labs. He's a pioneer in bringing laboratory services in India at par with the Western world. Under his expert guidance and leadership, Dr. Lal Path Labs has become one of the most reputed laboratories in Asia. Dr. Lal is currently the advisor of FICCI's Health Services Committee and is its outgoing chairman. He's the former president of NatHealth and the Health Services Committee of the PhD Chamber of Commerce. Dr. Lal was awarded the Padma Shri in 2009, and he's also the first civilian doctor to be granted an honorary brigadier's rank in Armed Forces Medical Services in 2009. The webinar session today will be moderated by Mr. Anjan Bose. He's the healthcare practice leader and advisor at Praxis Global Alliance, and he's also the founding member of NatHealth India. With love commonly referred to as Anjanda, he has over 41 years of global healthcare experience with deep experience in emerging markets and financing programs for medical products. Mr. Bose is the former founding Secretary General of NatHealth, former founder Chairman of Medical Equipment Forum, MEF of FICCI, former Chairman CIA Medical Equipment Division, and the past President at Philips Healthcare and Consumer Lifestyle, India, South Asia. He is also the past Director at HP, Emerging Markets and Financing Programs, Asia Pacific. The panelists for this session are Dr. Ashutosh Raghuvanshi, MD and CEO at Fortis Healthcare, Mr. Rohit Sathe, VP Healthcare, Indian Subcontinent at Philips, and Ms. Meena Ganesh, MD and CEO at Portia Medical. Dr. Ashutosh Raghuvanshi is the MD and Director of CEO and CEO of Fortis Healthcare with an illustrious career spanning over 26 years. Prior to joining Fortis, Dr. Raghuvanshi was associated with the Narayana Hrudayalaya for over 18 years, and he's been instrumental in getting NH successfully listed in the Bombay Stock Exchange. Mr. Rohit Sathe is VP Healthcare for Philips India, Indian Subcontinent, and has almost 2 decades of work experience in healthcare, construction, e-learning industries in India as well as UK. Rohit is also part of Philips India leadership team and oversees key initiatives to improve access to healthcare in the areas of prevention, diagnosis, treatment. Prior to joining Philips, Rohit was associated with J&J Medical India, where he played senior roles within the cardiovascular, neuro, and orthopedic business. Ms. Meena Ganesh is the MD and CEO at Portia Medical, India's leading home healthcare company. With a career spanning over 3 decades, Meena has been listed as one of the most powerful women in India by Business Week. Prior to founding Portia Medical, Meena was the former CEO and Medical Director at Pearson Education Services and Tesco's Hindustan Service Center. I hereby extend a very warm welcome to the entire panel. Thank you for being part of this forum on behalf of the Praxis community and look forward to having you today. In addition to the above panel, we were also supposed to be joined by Dr. H. Sudarshan Ballal. Unfortunately, due to some personal unavoidable circumstances, he was not able to make it today, but we look forward to having him in the subsequent events. Before we kickstart, I would just quickly, if we move to the next slide, like to just point to some guiding norms for this webinar. So, we will have, obviously, all the panelists will be on video, and we encourage a very interactive discussion. All the participants, we request to keep your audio on mute. We will obviously take questions. So we've kept specifically 10 minutes at the end for all Q&A. So if you have any questions on a specific point during the webinar, please share it on the chat box and we will address it towards the end. And post the webinar, we will be sharing the key takeaways of this session with all the participants. And if we move to the next slide. Specifically, today's agenda will encompass a series of questions aimed at understanding the impact of the pandemic and what healthcare stakeholders can do to overcome these challenges. We want to talk about what was the impact of COVID. We want to talk about, in this post-COVID era, how do we drive growth and capacity utilization while not compromising on patient care. We want to talk about how do we drive patient outcomes and comfort. We want to talk about the medical workforce and how to drive a feeling of confidence and safety for them. We want to talk about how can different healthcare players improve their operational excellence by looking at new delivery models. We also want to look at any operating model changes, looking at remote care, etc. And finally, how do we leverage digital and cutting edge technologies for the future? I would now like to pass on the baton to Mr. Ranjan Bose to kick off and initiate this series of webinars.
Okay, Ariman, thank you. I still have to ask you because I am on my mobile phone screen. Am I audible and visible?
Yeah, perfectly.
Okay, great. Because I can't see all of you. Dr. Lal will give an overview of both government and public response to the coronavirus and what has been the learnings from this unanticipated and seriously challenging pandemic crisis. Along with, of course, his valuable thoughts on the future of healthcare. So it is, as usual, always a great pleasure and privilege requesting Dr. Arvind Lal to kindly deliver his keynote address. Dr. Lal, please.
Thank you very much. First of all, I would like to thank Praxis Global Alliance team, and in particular, Mr. Madhur Singhal, Mr. Aryaman Tandon, Mr. Shashikant Chaurasia, who's really taken a lot of trouble, Mr. Anjan Bose, my old friend, my old Secretary General from Nat Health, Dr. Sudarshan Ballal, who's not here, Dr. Ashutosh Raghuvanshi, Mr. Rohit Sathe, and Ms. Meena Ganesh. So it gives me great pleasure to have been invited here. I also welcome all the panelists, all the participants here. And I wish that this pandemic goes away sooner than later. So ladies and gentlemen, I would like to state the very fact that I am addressing you today through a webinar instead of being in front of you physically is very much a part of the new normal we are all facing. Life has, as we know it, has changed as over 6 million people have been infected by the COVID-19, which was declared a pandemic less than 3 months ago. The outbreak's progression in India has been relatively slow, but we'll talk about it later. India took certain proactive steps and channelized all its resources to prevent community spread, which many people are now saying has taken place, with concerted efforts made by stakeholders across all verticals. The private sector also stepped in quickly, whether it was donating to the PM Cares or producing PPEs or making masks or hygiene supplies or ventilators or ensuring their employees' safety. After all, it is not every day that you witness car manufacturers turning their facilities overnight to manufacture ventilators, in this case, Mahindra and Mahindra and Maruti. India's three tango, 3T approach of tracing, testing, and treating, and cluster containment strategy and communication about prevention and social distancing has provided us with an upper hand against COVID 19. As a result, India has fared better than developed countries, including the USA. Initially criticized for a very low rate of testing, we were able to quickly ramp up, and now we are on the verge of testing 2 lakh samples a day from the current 1 lakh per day. Early detection of cases has been further leveraged for extensive contact tracing to break the chain of the transmission. As the number of cases started rising, the government took a very stringent 21-day lockdown 1.0 as a cluster containment strategy, which was followed by 3 more lockdowns of 2 weeks each, gradually easing movement with every lockdown. India has a relatively flat curve and doubling time slower than several other countries such as the USA, Italy, Spain, and the UK. While doubling of cases from 1 to 2 lakh took 15 days in India, it just took 5 days in the US. India has also been able to achieve good clinical outcomes for COVID-19 patients with a death rate of about 3%, and almost half the patients have recovered from the infection, while the death rate in the US, as we all know, is about 6%. Scarce availability of healthcare resources, medical staff, beds, excuse me, beds and critical care equipment like ventilators and essential supplies like PPE and test kits posed a huge threat to India's preparedness. The private sector healthcare providers were quickly roped in by the government to help expand testing and COVID bed capacity. Banning export of critical items and quickly ramping up indigenous production helped control the situation, but healthcare administrators and workers had to bear the brunt of this situation, working with very limited resources and risking their lives. Health being a state subject, state governments are aggressively fighting the outbreak with innovative solutions. Take, for example, Kerala, where the infection was first reported in India, has been able to contain the outbreak effectively till now. Kerala started surveillance at the airports in late January and relied on extensive testing and door-to-door contact tracing to limit the spread of the infection. At 0.5%, COVID death rate in Kerala is truly impressive. Maharashtra and Karnataka were the first movers in demarcating dedicated hospitals to prevent cross-infecting other patients by treating COVID patients in regular hospitals. The dedicated hospitals were set up in a short span of time with the help of private healthcare providers pooling in their resources. While states that have robust health systems have responded well in controlling community spread as well as death rates, one cannot expect similar outcomes in states with weak health systems. As a developing economy, the overall impact of COVID-19 on India has been significant, and it has put already vulnerable population under further distress. India crossed over the 2 lakh COVID-19 cases mark this week, and panic has struck because we know a large majority of people have no access to healthcare, example, the migrants going back to their home states. The current situation has placed us at a juncture where going forward, we have to make radical reforms in the country's health system. We cannot go back to how things functioned in the pre-COVID days. While deaths from infectious diseases in India are much higher than the global average, India's increasing burden of non-communicable diseases, or NCDs, is a huge concern, accounting for over 60% of deaths. Our health system is failing to bear this dual burden of disease due to inadequate financing, weak infrastructure, as well as shortage of healthcare professionals across all levels of care. COVID-19 has reminded us how health has a direct impact on the economy. We should not have to make a case for inventing in health anymore. It is a given. India's public spending on health has been grossly low for decades. Our public spending on health in FY 1920 at 1.5% of our GDP suggests that we may once again miss the target set in the National Health Policy 2017 to spend 2.5% of GDP on health by 2025. We need to spend an additional 0.5% of GDP to the tune of 1.2 lakh crores every year in order to reach this target. Further to public health spend, the government needs to create an enabling environment for private sector to invest in healthcare. The private sector has been instrumental in providing health services and bringing advanced healthcare to India, be it diagnostics, treatment options, or drugs, or medical devices, or health technology, or medical tourism. Another source of funding healthcare in India could be through the route of corporate social responsibility obligation of the Indian industry, which the country cashed upon by making immediate amendments in CSR rules to contribute towards COVID-19 response. The CSR rules are otherwise not so enabling, with various deterrents like over-reporting, unproductive scrutiny, and ambiguity in what counts as CSR. The government needs to look into it, especially clauses that deter companies to invest in areas where their core competence lies, especially in healthcare. That is, take for an example, in pathology testing in underserved rural areas for a country like ours. Over the years, the government has attempted to address the challenge of equity, accessibility, affordability, and quality of healthcare by assuming the role of the provider, and more recently by moving to be a payer and, of course, the regulator. As a provider, public health facilities are largely inadequate in India. We have only 0.55 beds per 1,000 population, and this too varies across states. 12 states in India account for about 70% of the total population and have less than the national average of 0.55 beds per 1,000 COVID beds. Majority of hospital beds in India are in the private sector, that is 68% in urban areas and 58% in rural areas. There is also acute shortage of healthcare staff at these facilities. Government's own statistics highlighted shortage of about 80% physicians and specialist doctors, 20% nurses and pharmacists, and 40% lab technicians at community and primary healthcare levels. Major quality concerns also exist in government-run health facilities in India. In fact, hardly any government hospital or lab possesses quality accreditations by NABH or NABL, which have become staple for private hospitals and diagnostics labs. As a payer, reimbursement rates set by the government for various services provided by private healthcare facilities are very low and often fail to cover even the cost of delivering care. We carried out a scientific study under the aegis of FICCI when I was the FICCI chairman, costing of healthcare in 2018 when Ayushman Bharat PMJ was launched. The study revealed that for some procedures covered under PMJ, the package rates covered were as low as 23% of the cost of the procedure. This implies that prices are fixed without consideration of costs, and on top of that, payments are delayed for months, if not years, severely impacting cash flows and sustainability. The industry has been advocating for differential pricing in healthcare for a long time, similar to the Indian Railways model. Private healthcare providers account for more than 70% of outpatient care, more than 60% of inpatient care, and 80% of bed capacity expansion in the last decade. Therefore, no public health program or response can be successfully implemented without the participation of the private sector. The private sector has always been eager to partner with the government to improve healthcare in India. But even then, the government and the public in general often exhibit diminishing trust on private healthcare providers, which manifests in the form of negative publicity and sometimes violence against healthcare professionals. Even in the present time, we can talk volumes on the uneasy relationship in states like Maharashtra, Gujarat, and Delhi. We need a radical shift in how government and private sector engage with each other as true partners to deliver care. The government must acknowledge that private healthcare providers and companies have to meet their fixed variable costs, set aside budgets for expansion and contingencies, and meet their obligations to generate reasonable return on investment for their investors. I have myself had to answer this question in many seminars, that why people should invest in healthcare when the returns of even fixed deposits are better. It is well known fact that many private hospitals take more than 7 years to break even. Healthcare being a capital intensive sector, the industry cannot sustain and survive without financial incentives from the government. Additionally, private sector participation in all policy dialogues and health related committees and bodies must be ensured. A case in point would have been to have private industry representation as co-chairs of the various empowered groups of secretaries constituted to fight the COVID-19 pandemic. The way we have traditionally delivered healthcare will also change, and technology will play an important part in this transition. Virtual care and telemedicine can become the norm, along with the use of artificial intelligence, machine learning, virtual reality, and augmented reality. As shown by this pandemic, our health system is extremely vulnerable, fragile, and neither the government nor the private sector healthcare players can address a healthcare crisis alone. As we learn to live with COVID, resuming the economy with Unlock 1.0, we must think of new enhanced health systems for this new normal and not lose the momentum and the opportunity to transform healthcare in India. Thank you very much.
Thank you very much, Dr. Lal. As usual, your even brief few-minute address gives a whole lot of food for thoughts for all of us. So thanks for covering a wide range of topics and in your very, exemplarily candid way. Thank you so much, Dr. Lal. I would start the the discussions based on what Dr. Lal said just now. But at first, a very broad question. We have Meena from home care. We have Dr. Raghuvanshi from the deliverer side. We have got Rohit Sathe from MedTech. So we have a very variety of top leaders in Indian healthcare here. What is the impact? It's a broad question, so please choose to answer in your own way. What is the impact on hospitals, on diagnostics? On diagnostics, I'll come to you, Dr. Lal. Diagnostics, medical technology, healthcare, home care companies. It's a very broad question. I think your experience that you can share with the audience would be of immense help. So, Meena, you want to go ahead? What has been the impact on home care companies the last couple of months?
Sure. Good to be part of this webinar, and thanks, Anjanda. Good to see you again, even though virtually. The first, immediately after the lockdown started, obviously there was a huge impact because any kind of healthcare that requires people to move around is obviously massively impacted by such things such as lockdown. So the first 2-3 weeks, it took us to sort of figure out how do we go around this when people, even though the government has said that healthcare workers will move, it's not necessarily something which immediately gets translated to the ground. So the first 2 weeks were pretty rough, but soon we sort of figured out how to continue to provide services. One of the things that works in our favor as a home care company, we can provide those services which require for the helpers or that is the nursing attendants or the nurses to actually stay in patients' homes. So we quickly moved into stay-at-home model for as many of the services that we could. The things which are more that will require people to come and go, such as physiotherapy or doctor visits, etc., obviously took a big hit. So that was the impact, immediate impact. But thereafter, some very interesting tailwinds have started to emerge. First and foremost was that the moment teleconsulting guidelines were offered, then we were able to quickly put together a teleconsulting offer, which we already had, but it was possible for us to move that much more quickly and rapidly through our entire existing ecosystem of patients. And we have served about 8 lakh patients today. So even just reaching out to them and saying, do you need a support now because you're locked down, you can't consult your doctor, can we help you, itself was something which gave us a quick upswing. The other things which are very interesting tailwinds which then came are things like a lot of pharma companies, for instance, approached us and said that our patients are not able to go to their clinics and to the doctors to get the ongoing therapy. How can you help on the ground? So that was a quick, immediate requirement, and we started to move. And even to the extent of some of them saying, can you provide a complete chemotherapy solution at home for those who've already done a few cycles? Can we do that? Now, some of these tailwinds started to move, and that has, and of course, as the hospitals open up, our business has also grown. The other piece, which is absolutely new and which is very important to our own role in the whole COVID management situation is. And towards middle of April, we started to speak with some of the governments. And in fact, with the Delhi government on 4th of May, we started working with them to support patients who are home isolated.
Okay.
So we put together a complete remote model of monitoring these home isolated patients for Delhi, and then a few other states we have since then started. At this point, we support nearly 8,000 home isolated patients, monitoring them on a daily basis, seeing how their health is, if they have any health issues, providing them with a doctor teleconsult. And if things are worse than just a teleconsult, working with the local machinery and moving them into hospitals. In fact, in Delhi, 93% of the people that were on home isolation have been kept at home. Only 7% needed to get any kind of escalation which required hospitalization. So from a impact on the ground, it has been very substantial because all these people did not have to go to a hospital. And like Dr. Lal was saying, the hospital infrastructure is already struggling so much. So being able to support in this in some fashion has been very helpful and satisfying.
Thank you, Meena. I just want to ask, one more thing to you.
Sure.
Two things, in fact. One is in the lockdown situation for more than 2 months. How did you? I mean, you must have faced a lot of challenges in having your people go to the home, etc., etc. So, any quick comment on that? How you managed to overcome that? Yeah,
absolutely. The first 2 weeks, like I said, Anjanda, was absolute chaos. We didn't know what to do. We tried to send with a pass, no pass. How do you get all that? So those were very challenging times. After that, things have kind of settled down into a decent routine. What interesting thing also is that because there is a lot more of worry about letting people into your homes to help seniors or sick people, the patients are also looking for more organized players rather than taking your local service providers. So in a way, it works in the favor of those who are organized, who have got great quality, who can actually show up that how we take care of our people. So from that perspective, it helps. Certain interesting innovation that came in, for instance, physiotherapy. Throughout the lockdown, obviously there was none, but we started to do video-based consulting for a lot of our patients, and that was something that they really appreciated. And now going forward, what we are offering is a mix of both. We can do video, we can come to you in person. Let's have a mix of both of those. So it helps us innovate and come up with new solutions.
Sure. Thank you. So possibly, we'll discuss that in the next few half an hour or so.
Sure.
Possibly a new normal would be for home care segment. A combination of home care and the teleconsultation will possibly now be one of the new normals with which we'll get habituated. That could be an enabler for future healthcare. So thank you, Meena. Thank you very much. Rohit, let me come to you before going to Dr. Raghuvanshi for the big chunk, the providers part. As a top medtech company, how did you address this challenge? I mean, since I have grown up in that environment, frankly, on a lighter tone, I sometimes, I felt I was happy that I was not in your position in Philips anymore. But how did you? That's a lighter, in a lighter way, a lighter comment. But I think I have been hearing fantastic job done by the customer support, supply chain. How did you manage to overcome this unanticipated challenge, Rohit?
Yeah, thank you for your question, Anjanda, and hello to everybody. Good evening, good afternoon, good evening. And yes, indeed, I mean, very, very challenging times, and some of the challenges that Meena spoke about also, were applicable to our company. But in all these times, our first thought actually went to the patients, went to the customers. Okay, and when I say customers, and there are customers like Dr. Gavanchi or Dr. Lal, because these are the hospitals and diagnostic centers that have our machines, and our machines cannot be switched off. This is not like a car that you park in the garage and you forget. These have to be on. They have to be connected with the power supply, everything. If there's an MRI, then there's helium, and the helium might escape. You need to then take a truck of helium there and fill it up and everything. So I think that was our first thought, and we've actually had to go through several hoops to ensure that our service has ever been present. Whether it was people moving through with passes and all that, through different districts and states, obviously using surface transport. Sure. We've had our team actually travel in transportation trucks with our spare parts and everything. We've also had people sometimes stay over in hospitals because they were not able to do their job and return back home. Sure. So a lot of difficulty over there. Of course, supply chain, both domestic as well as international, in terms of getting spare parts, all that was quite difficult also. So I think as a health tech company, our primary motive was initially taken up, our entire bandwidth was taken up by just supporting our equipment. I don't think we were in a position to even think about developing business at that point in time, at least for the first 2-3 weeks. Once that started sort of, simmering down, I think we've had great support from our customers, both in hospitals and diagnostic centers, where we've been able to remotely connect with them and talk with them as well. Okay. How you do that is basically using things like Zoom. So in fact, even in a tier 2, tier 3 city in the eastern part of the country, like a Bihar, Jharkhand, in those kind of places, our team has actually gone and done a deal completely without even meeting the customers, right? So demos done online, all those types of things. So again, much like Meena said, we've noticed a lot of difficulty, but we see a little bit of sort of a release coming out here because of the lockdown. People are able to circulate very easily, but we still see that there's a far distance to go, and our future is absolutely tied to the future of the hospitals and the diagnostic centers. So we're in a position right now where we have to put all our effort come together, and I think partnership is the key word today. So it cannot be the government pointing fingers, or the hospitals pointing fingers, or us pointing fingers at anyone. It has to be everybody coming together and looking for a solution to this whole COVID problem.
Okay. I like that. I think collectivism, good collective collaborative teamwork is the name of the game, and that is going to be not only an accelerator of future progress, but an essential necessity. Sorry, if you're saying something more, please go ahead.
No, that was what I wanted to end with, because that is absolutely crucial for us to come out of this together, because all of us are suffering. So we have to come together and solve this and move on.
Great. And then a quick one, since I feel tempted to ask you, since you are the tech representative in this eminent panel. So do you think, like Dr. Lal said, artificial intelligence, machine learning, augmented reality were sort of buzzwords so far, but now suddenly they are assuming an all-important role. What's your perspective on that?
I believe that our landscape is going to change absolutely towards that direction. I don't think there's a coming back, and that's a good thing. So remote connectivity. I just spoke about a transaction being done completely remotely, but treatment of patients, diagnosis. I mean, even today, there are patients who are getting, consultation done remotely, but even monitoring of patients, treatment of patients, using artificial intelligence and remote connectivity. I don't think there is any looking back. This is the new normal. The world has changed. Okay, so if anybody thinks it's back to the old normal, that's not going to happen. And I think we have to sort of metamorphose into that type of an organization that can provide these services. We firmly believe that.
Sure, strong word, metamorphose, but that's exactly what I think we should do. Like the ancient wise philosopher Pluto said, that necessity and crisis are the mother of inventions. So I guess many such inventions will come from the tech world, from home care, from all the segments. Last but not least, on this big impact question, let me go to Dr. Raghuvanshi. We had 2 providers, but unfortunately, Dr. Ballal, as Aryaman mentioned, had to go because of some sudden personal crisis. So let us hear Dr. Raghuvanshi. You are the last mile as far as the patient is concerned. What has been your experience, for a big corporate chain like you with hospitals in multiple cities? We are all keen to hear your experience of how you have been handling the challenges, and also many requests from the government that has been coming. One including one that came from the Delhi Chief Minister and the Delhi government today about the price capping. So, would you like to give us some big impact picture of how you are handling things, Dr. Raghuvanshi, please?
Yeah. So in the early stages, obviously, like what Meena said and what Rohit said, I think we had serious logistic challenges. We had our staff related challenges, how to move them. And then there was a question of rotating the staff because once they are exposed to patients, you need to give them a break as well. So there were several challenges. I think most of them gradually sort of fell into a pattern, and many measures were taken. But I think it was also very important for us to bring that confidence in the healthcare workers, especially the frontline nurses, technicians, etc. So I think first focus we did was to institute some measures which brings that sense of security amongst that the frontline people. So there were a lot of things like insurance, medical insurance, for example. A lot of people covered only under ESI. So we covered the entire organization right in the beginning of this episode. And similarly, we enhanced the life coverage, etc. We said that all the co-payments will the company will bear all the co-payments for medical insurance if anyone requires treatment, etc. So these were confidence building measures so that people could work with a sense of now, as far as you said that it's the last mile. It's in my view, healthcare is an ecosystem. Unfortunately, in the past, it was only looked as an episodic thing where you're treating episode of illness, and that is what it was. And I always used to say that many times we call it healthcare industry, but we only talk about sickness and disease and never about health. So I think the other components of healthcare were coming in focus even before this pandemic came into being. Like, for example, remote monitoring, taking care of people at home, and all these things were there. Telemedicine is something which was being talked extensively for last 20 years, but it didn't take that center stage. I think as we go further, we have to sort of look at this entire ecosystem of care. And I think these components, especially remote care, etc., are going to become very, very important because it is not just preventing the infection, but these are simply more efficient ways of delivering and a complete care. So I think the role of these things will become more and more important as we go further. The business model of traditional hospital will also have to evaluate how to participate in that ecosystem. One of the other things we were talking about earlier, Anjanda, about collaboration. One of the examples is that, all 3-4 hospitals in Gurgaon, they came together. These are traditionally, competitors. They all got together and contributed with staff and other things to open kind of a common facility. I think that is an example of how the industry has come together.
Yes.
The difference. Yes.
Wonderful. Wonderful point. Especially the last point that you make, if I may add one line, the genesis of Nat Health was that actually, that, competitors as collaborators, everyone working together. So, I think it's a very important point, particularly at this time. Since you mentioned about confidence, comfort, let me ask you, because that's going to be a question for, I think, all the eminent panelists, that there is a question of balancing out, patient care with the growth and progress. Hospitals have been far from being full. Medical tourism has stopped. The elective surgeries have been postponed. OPDs have not exactly been full. So how to ensure patient comfort and safety feeling, especially in the big cities like Delhi, Mumbai, where the numbers are scary to an ordinary citizen. So I know it's a difficult question perhaps, but we have to do something together, possibly awareness generation, communication program. Any thought on that, Dr. Raghuvanshi?
Yeah, so as the community spread happens, whether we define it as such or not, but the fact is that people are likely to get infection. So any patient who's coming to the hospital is potentially infected, and both the healthcare workers as well as the patient needs to be protected.
Sure.
And I think that has to be very visible to patients when they come to a hospital for any episode of illness. I think that is one very, very important confidence building measure. So the segregation, the patient flow right from the entrance of the hospital is what makes a difference. And I think that makes a difference also. Now we have a lot of experience. We have treated well over more than 1,000 patients, approximately about 1,400 patients within our network. And about 40% of that were treated in critical care. So there is a lot of expertise which has started developing. People are learning from some of the mistakes which were made early on, and that has been very helpful. The other part, with what you said, that the occupancy levels currently are very low, because traditionally what happens in that there is a good component of medical travelers who are coming from international markets, but at the same time within the country there is a lot of movement, as you know, that from east a lot of patients move to south.
Yes.
People from Calcutta move to Mumbai for cancer treatment even now. So all those movements have also stopped. So both those things have contributed in a big way to bring the occupancy levels down. So currently hospitals are able to support the corona work as the overall occupancy levels are low. But my apprehension is that as we go further down into the pandemic, and if the numbers rise, then we would have challenges on human resources side. There are people who are healthcare workers who are going to get infected in spite of all the precautions, and that would again take over a certain chunk people out of the system. So I think those are very serious challenges. I think many of these debates about availability of human resources, the technology platforms like telemedicine has been around for so long, but we didn't have those regulation or whatever guidelines for so long, in spite of the understanding that that's an important component. So what I feel is that many of these problems which we are facing today as a system and as a country, I think all these points have been recognized in plenty in past. As Dr. Lal said initially, all these things have been recognized earlier, but we haven't made sufficient effort and we haven't invested enough in these things. So now this has brought all this in focus. And now it's important that we address these things systemically. The pandemic will sooner or later go away. Now, private healthcare has somehow become the favorite whipping bag of everybody, the authorities, the media, and everyone. And but the fact remains that private healthcare in a country such as India, where so many people are almost towards a poverty line, private healthcare cannot substitute the public system. It can only complement. And I think expectations from private healthcare are very, very unreasonable. One of the things you asked about the authorities, I think the consistency in policy and instruction has not been there. The instruction keeps changing. One day they say that 117 hospitals in Delhi are covered under this. The next day that becomes something else. Then 3 hospitals are taken. Then 20% beds have to be taken. So people cannot prepare if you do not have a visibility on what you're supposed to do, and the instruction keeps changing. Then there is a problem. And similar problem is being seen in the testing side, for example. Suddenly there will be instructions that you can't test this, or there cannot be any pre-operative testing, etc. And that's considered as violation of the ICMR guidelines, which is not the case actually. But these things confusion in public's mind, and I think a consistency on the authorities side is very, very important. I think and that's probably if we have to go through this without much.
Sure. Thank you. That's a very important point. We are taking away the important points from these very valuable deliberations, and we will create a forum where such important points are taken to the stakeholders, especially the government. I think they are also learning. The government is also learning. So thank you very much for the good points you've made. Let me go to Dr. Lal. Dr. Lal, can I ask you, your quick thoughts on all these will require tremendous focus on improving operational excellence. And I think that's a question for all of you, whether home care or medtech, health tech, medical insurance, definitely hospitals. So Dr. Lal, from your vantage point in the industry, not only as the diagnostics leader in this country, any quick thought on how to get back the ship on shape by improving operational excellence? I mean, one quick way is to reduce cost, but we cannot compromise on quality of patient care. So any quick thoughts, sir, Dr. Lal?
I think the first thing which must be, changed is the perception of the private health players in the eyes, in the minds of the, our people, the population, including the judiciary, including the, legislature, the lawmakers, whatever. So this has to be done in a very calibrated kind of a view. And I've always maintained, and Ashutosh is actually facing the brunt of it these days,
Sure.
in the government's eyes, the private players, they are not actually looking at what your difficulties are. They are saying that, well, this is the price. This is the price which is acceptable to us, and you have to do it. And they don't say take it or leave it, you have to take it. So this, unnecessarily the atmosphere gets vitiated. So my first wish would be that there should be kind of a meeting ground where at least it may not happen, the operation, they may not be able to solve anything, but at least with a full kind of a mind, they are able to listen to you with an open, as they say, you can't shake hands with a closed fist. So that I find is still missing right now.
Sure.
And this is not the forum to discuss those kind of
of course,
which are happening
Sure.
Around the country. The second thing which I would like to emphasize is that this is a pandemic where India has been caught napping as far as the infrastructure was concerned. And initially, if you remember, there were no N95 masks, there were no PPEs, and many medical personnel got infected because of the lack of these minor things, and everything was made in China. So I look at it in a very positive kind of a way, that this is the time when we can actually do something on the ground here and move away from China. And as I told you that that there are people like Agwa and BL and Maruti and Mahindra and Mahindra who have stepped into making ventilators, and that too 40,000 ventilators is not a joke when there were just a few thousand present in India.
Sure.
So India is capable of changing, but who will bring that change? Point number one.
Good. Yes. Thank you.
Yeah. And the second thing is in testing, of course. The testing, according to government figures, should touch about 2 lakh patients per day, and it has already crossed 1 lakh patients per day. But the attitude towards testing of various agencies is not what it should be. It's a very open and shut case. I mean, all of us are coming from a very heavy background of healthcare, and such thing we used to talk about tuberculosis. That is he an open case or is he a closed case? Would you stay in the same room with an open case? The answer is no. Right now, these open cases are, the policy, what Ashutosh was saying, that the policy is flip-flop. Today, yes, tomorrow, no, and day after tomorrow, maybe. So all these kind of things, we must get our act together and move, forward in a calibrated manner.
Good point. Who will bring the change? Possibly the eminent panelists here are some of the top leaders who will play a major role in bringing this change. Dr. Lal, I think I'll pick up one point that you said about, PPE couple of months back and PPE now, ventilators couple of months back and ventilators now. We have the capability, but like I think Rohit used the word, we have to metamorphose. let me go to Rohit, because he leads globally one of the top health tech companies, and a company in India that has been for 90 years nearly. So very much Indian also. So Rohit, what is your quick take on, Make in India was launched with a lot of excitement few years back, but we all know the percentage of import, it hardly reduced. So do you think there is a possibility here, and which could also generate more employment and generate more, speedy manufacturing of many of the products? Of course, it will depend on economy of scale, etc. Your quick take, please, Rohit, on this.
Yeah. So, Anjanda, absolutely. I think, in fact, if people on this webinar remember, there was something in the news as well, from Philips, where we said that we are investing quite heavily in Make in India over here.
Sure.
We are quite a high tech sort of product manufacturing company, and in our Pune plant, we've in fact doubled the land that we had out there in whatever manufacturing we were doing. We were only doing manufacturing from one modality, which is the mobile surgery C-arms. We're getting into ultrasound machines now and MRI coils and all that. So I think we're just spreading. Now, the important thing over here is India does have a lot of talent. I think a lot of panelists have touched upon that. We have a lot of brilliant talent. We are the capital of creating engineers, developing engineers over here in India, right? Sure. But I think the role that the government has to play and the kind of infrastructure that you put in place out there also has to play a complementing role over there. Sure. Okay. Otherwise, I think we would all love to make in India and make absolutely everything in India. Sure. And we are doing that. The other thing is not just should the infrastructure, the laws, taxes, all those types of things should be conducive to doing this for India. It should be conducive to doing it for the rest of the world. Because, medical devices specifically, if you have a critical mass, then yes, you can make everything for India and your facilities are good enough only for India. But in a lot of specialist type of medical devices, you don't make those many. I mean, if you look at the number of MRIs, you don't make MRI, you can't make a factory only for India, right? But if you can for the rest of the world, right? So, you have to make a little bit of a distinction over there, because if you try to make things only for India for something that is of low volume need,
very good point,
then you might not have critical mass over here. But you might be able to, if the policies are right, if the support from the government is right, and I believe that we are getting some of that support from the government already, and that's how we're able to expand our manufacturing facility in Pune. Then you can make not just for India, but for the rest of the world as well. Okay.
Thank you. Very, very appropriate point. I know your, Philips has been, and like that, a couple of other organizations have played a major role in bringing in quality technology in this country. But what I hear you, I think I've heard before, there is improvement, but there is a long way to go. The policies must be more manufacturing friendly. It must be more welcoming to the organizations from outside to be able to come, and the infrastructure should improve further. And thank you, Rohit, for bringing these points to the fore. And possibly, like Dr. Raghuvanshi said, Ashutosh brought out a very important point. If there are guidelines which are translucent, not transparent, or even opaque sometimes, it is very difficult to sort of, make a plan which is a long-term plan, which you need possibly for investing a lot in this country. So thank you for making that point. I think we have to make a collaborative approach, not only within private sector, but with the government, and we have to resiliently, without giving up, bring the point, because government wants to do Make in India, and the pandemic has brought out that point even more strongly. Thank you, Rohit. I'll sort of go to Meena and then ask the free-flowing last question. The last question is, healthcare is, I think one of you said that it is, I think Ashutosh again said, it's not only the hospital last mile, fine, the patient goes there, and for home care also the patient is in that segment, but it's like a jigsaw puzzle with all the segments playing a major role, and we need possibly a very harmonious approach amongst the various segments to be able to succeed, which is giving quality patient care in an affordable manner, to the last mile, that is the patient. So in this context, what has the pandemic taught us in terms of, I know we touched upon the technology, we touched upon operational model. If all of you, I request in the next few minutes to summarize, this has been a beautiful discussion, by the way, very free flowing. And I would really appreciate if you can give your, couple of thoughts which we can carry forward. What are the key things what are the key things? Like we are in response stage now. After response, possibly there will be a reset because life will not be as usual. And then we have to reboot. So in this context of the three R's, would all of you, Rohit, you are on the screen, at least I can see you. Can you sort of give your two bit? Then I'll go to Meena and Ashutosh and Dr. Lal, of course.
Sure. So I'm just going to, I'm just cognizant of time. So there are basically just two things that I would like to say are definitely very, very crucial. One is the move to digital. I think this whole, thing about remote connectivity, whether it is about treating patients, diagnosing patients, taking education, a lot of our children are actually taking remote classes also, working from home, all those things. This is new reality, not going back again. Has to happen. So digital is the first truth, has to happen, no turning back. And the second one is collaboration. In tomorrow's world, you cannot stand alone on your own and try to do things and achieve things. So I think you have to partner with everybody. We are at the bottom of the pit right now. For us to get out, we have to stand on each other's shoulders and help each other out and pull each other out of this hole. So that we can all then prosper.
Sure. Excellent. Digital and collaboration. Meena, your two bit, please.
Sure. So a couple of things that come to my mind is that different parts of the whole healthcare ecosystem have worked, like we all said, in silos, and they have to come together. And the reason why they have to come together is not just because the normal is changed or people will now look at digital, but also there is a whole extremely vulnerable population, which is the seniors, people with comorbidities, will not be able to access healthcare the way they were doing earlier. They are not going to be able to, or willing to, or it is not appropriate for them to even walk into a local clinic or into a hospital setting for some time to come. So how do you still serve them? And how do you bring all the pieces that are required for them to be served, whether it is just a consultation, diagnostics, some support in a hospital thereafter? How do you keep on making sure all these pieces work well, especially for the more vulnerable section? That is one point that I'd like to say.
Sure.
The other is that the government has really taken a couple of steps forward. In some ways, it looks draconian, but on the other angles, they are really needing the support of the private sector. This is not going to be a solution that can be done just by the government or only by the private sector. We've always spoken about PPPs, and PPPs have not been the most shining success in many of the places in healthcare, but I don't think there is much choice. This is the time for us as a country to rebuild, whether it is our healthcare or the economy. Everybody, the government and the private sector, will have to come together. And I do believe that the government is looking at this a little more openly. They are co-opting people so in their solutioning, because they don't have all the answers truly. And something of this nature has shown that the answers are not with the most intelligent people in the bureaucracy or in the government, but all of us have small bits that when these bits come together, then things really change. And especially they are looking at entrepreneurial kind of solutions, and the way the pace at which they are talking to us about solutions is just incredible. You propose something, it will make sense. They said, yes, let's go ahead. Within a week, we're up and running and doing something. I mean, those are things which are unheard of. So clearly, everybody is hurting. We all have to come together, and this is an opportunity to do something very, very different and innovative, especially for the vulnerable sections.
Sure, excellent. Thank you, Meena. Point well noted. And I think we'll all have to work together on these important points. Thanks so much, Meena. And your emphasis on the vulnerable section is extremely important. That we are a private sector. There has to be, of course, bottom line and focus on that. But we cannot forget that healthcare is a sector where I think it's the only sector where the word care is there in the sector's name. So thank you very much, Meena. Ashutosh, your 2 bits of wisdom, please.
I think the points Rohit made were very important, both of them. And I think Meena also said the same thing. So digital definitely is one of the ways.
Sure.
I think this makes things very, very efficient. The second point I want to make is that investment in public healthcare from the government is very much needed in India, and in a big way. And that means not only to build new hospitals, but also to make sure that the human resources part is handled properly.
Sure.
Because at least 60-70% of our population will not be able to access private healthcare, whatever we do, however efficient the private healthcare delivery becomes. People are not going to go to an economic level to be able to afford it. So I think that is very important thing which
Sure.
needs.
Absolutely. So more investment, perhaps in terms of percentage of GDP. Government has announced some increase. Possibly more has to be done. Thank you so much for your input. And lastly, yeah, something more, Ashutosh? Any other point?
I think 10 times of what they currently invest.
10 times, yes. We take that. I think that could be a slogan in the headline for the health news tomorrow. We need 10 times. I couldn't agree with you more. Let me go to, my elder brother, I would say, Dr. Arvind Lal. Arvind, please give us your 2 bits of wisdom as we move on from this beautiful discussion.
So the first thing is exactly what Ashutosh just said, that the government has to increase, and I actually named this figure, that even 0.5% of our current GDP tantamounts to 1,20,000 crore rupees.
Sure.
Now, we don't see this kind of money. In fact, they talk about a few thousand here and there, and every year it is, it not spent and it's gone back. So
Sure.
This is a question of management. You must be able to manage your finances and spend the money where it is due. If you don't spend money on healthcare, you won't get anything back. And you keep on, getting after the private sector, much like the 3% of people in India who pay income tax. Well, they are the easiest targets. Second thing which I would like to emphasize is that we must make use of this time in becoming self-sufficient, at least in healthcare. There are 3 things which I think where you have to be self-sufficient. One is food productivity. You don't produce food, but nobody's going to give you from outside. I have lived in an area where where PL 480 we used to be importing, food from outside. Second thing is defense. If you can't protect yourself, nobody's going to come and help you. And the third is healthcare. In whatever your act is, whether it is pathology or radiology, Philips, etc., ventilators, you please get it together. And you're already known as a country which innovates as far as vaccines are concerned, some generic drugs are concerned, etc.
Sure.
So right now is the time to claim your position in history and start making those APIs which were not being made and everything was coming from China. I keep saying China because I don't like that country. But anyway, that's a so. But that's what I want to say. Self-sufficiency should be the watchword.
Excellent, and it ties up with perhaps the point of technologically make in India as much as possible. Thank you very much, Arvind. Every good thing has to come to an end. Earlier this week, our Honorable Prime Minister in the 150th annual meeting of CII mentioned that we will get our growth back. That was the slogan. We will get our growth back. He mentioned 5 things necessary for taking India on a higher growth trajectory. And coincidentally, unfortunately, the same morning, earlier in the morning, Moody's had downgraded India to a rating which is just about investment grade. So Prime Minister gave the 5 I's to corporate India: intent, inclusion, investment, infrastructure, innovation. Intent, inclusion, investment, infrastructure, innovation. I see a lot of PPP already happening. I think in this discussion for the last 1 hour, many of you, all of you have mentioned things in line with this. So possibly a last beat of effort has to be there to have private sector and government come together, and leaders like you, like Dr. Lal, who have untiringly worked for that, I'm sure will make this happen. So we will all hope that healthcare gets its due attention through these 5 I's and through these turbulent times. Thank you very, very much, dear eminent panelists, for sharing your valuable thoughts in these uniquely challenging times. I will now give, it has been a pleasure as usual talking to you. A few more minutes, I'll request Aryaman and Madhur of Praxis to possibly, there are some questions to guide towards the eminent panelists, and then conclude this session. From my side, thank you very much to all of you.
Thank you very much, Anjanda. So I will just open the floor for a few minutes for a few questions that we have open. So I will first invite Nitin Kukreja, a close friend and also He heads Lupa Systems in India, which is James Murdoch's fund. Nitin, I think you had a question. Please go ahead.
Yes, thanks, Madhur. Thank you to the panelists. I think each of the panelists has spoken about digital and online, as well as speaking about the lack of health infrastructure. So my question is, which are the specific areas that digital will help address, or will the lack of health infrastructure still come into play? And what are the areas or the barriers that you still see in health becoming more and more digital? For example, when we come to the education space, teachers are still not familiar with digital. You still don't have the right platforms. Zoom is still not the right platform to teach on. So as we go digital, what are the specific digital barriers that you see as well, beyond just the healthcare related barriers? Thank you.
Yeah.
Yeah, I can put my 2 bit in the digital part. You see, everything is now telemedicine has been happening in India for a few years. I think at least 15 years, if not more. Now, what we have to understand is that in India, if you really ask me, you have got no other, option except to go digital. So we have a manpower resource, we have infrastructure, blah, blah, whatever. So the point I'm trying to come at is that there is not enough, bandwidth available, the optical fiber bandwidth. And this must be, made certain, because otherwise all your plans will go up. The room in which I am sitting, can you imagine that there is no, Airtel network here? There was no Wi-Fi here. And then they have come and boosted and God knows something. And even the Airtel, network is linked to the Wi-Fi, some new technology kind of a thing. So we are talking in Delhi, this is happening. And I live in South Delhi, which is supposed to be, a nice place to stay in. If this is happening right here, you can imagine what happens in the upper reaches of, say Uttarakhand, etc., where we are trying to bring all these, telemedicine, telepathology, etc. So we have to do something that this infrastructure is not with the private sector. It is with the government. And every time you ask this, government, shies away. And I believe this kind of a bandwidth is lying with the defense services, which is unutilized. So we must do something about it. Thank you.
Good point.
Okay.
Anybody
excellent.
else? Yeah.
I would, I would now request, I think Satish Kakkar, he had a question. Can you please go ahead? It's something around medical tourism. I'm assuming Dr. Ashutosh would be quite well placed to answer that.
Yeah, hi, good evening. My question is about the medical tourism. I'm in Delhi, and the NCR especially have a lot of patients, which comes from outside India. And that's big, COVID being a big thing. And it will be tough to attract those category of patients. So, it will be, I'm sure hospital must be having the plans to, handle those. But can somebody share from the panelists how it will be done?
Dr. Ashutosh, if I can request you to do that.
Yeah, so I think within the hospitals, I think hospitals are very much ready to treat the non-COVID patients as well. Most hospitals have created the kind of separation. Some hospitals had infrastructure issues like air conditioning, etc., which could be sorted out. But either they have chosen to address COVID patients or non-COVID patients, or they have been able to create a different infrastructure. So I think that part on ground is ready. Now, the biggest problem for the international patients is to travel. So the logistic challenges are still there unless until the international flights open up, and that segment is unlikely to resume to a normal. Our estimate is that it is going to take at least 6 to 9 months or maybe even longer before you can expect the same volumes as pre-COVID.
Fantastic. Thank you. I would then request, I think Yizen on the call, she asked a question around spend on healthcare IT and technologies. Yizen, do you want to talk about that?
Yeah, can you guys hear me?
Yes.
Basically, I had a question around in terms of the current healthcare IT spend, investments in technologies which enable virtual consultation or remote monitoring. What does that look like today, and how would that evolve given in the post-COVID world?
Yeah, I'll take a quick go on this. The traditional providers in India somehow have been very stingy on their spend on the ID side. And that's what is one of the biggest sort of bottleneck, as was asked earlier about the digital journey. So it's just not just converting the paper into a kind of an electronic form, but I think the true digital has to be achieved. And I think that's very important. Traditionally, the investments in IT in traditional providers in the country has been very, very low. And that needs to go up significantly. My estimate is that almost all providers are going to double, triple their IT spend over the next couple of years. That's my estimate.
I think that's excellent, Dr. Ashutosh. Thank you. One last question now. I'm just tracking time. Divyansh, I think you have a question around remote health monitoring. So I'll request Meena to probably take that. Yeah, Divyansh.
Yes. Hi. My question was as we have throughout the webinar, we were talking about the digital health monitoring system. In India, we have like till now, with rehabilitation technology, rehabilitation tech is not given a much importance. So with more investment in remote health monitoring, what will be the impact of this in rehabilitation tech?
That's a good question. In India, there are lots and lots of startups and entrepreneurs who come up with very interesting remote technology for monitoring, for support, for rehabilitation, for training, all kinds of things. The issue has been that the use case and the ability to go to market with it in a economically viable model. Now, given the fact that people are perhaps more comfortable in many circumstances to do things at home, there might be a change in the willingness of patients to pay for solutions which can be delivered at home, which can be monitored remotely. So if that kind of a change in behavior happens, and we are seeing a little bit of that, then actually it could give a big boost to these kind of technology. So it's not a lack of ideas, it's a lack of opportunities. And I do believe that will change in time to come, given the environmental change.
Excellent. Excellent. Thank you, everybody. I think that, we'll take this panel to a close. But, outstanding job, and, Anjanda, and thanks a lot once again for being so generous with your availability and time. It's been always a pleasure to partner with you. And more importantly, to everybody, each one in the panel, we really appreciate you making yourself available and being so candid in this chat. We're hoping that, we'll continue to have your association and blessings as we're participating in our small little way in building the healthcare ecosystem in India. So good day, everybody, and have a very good weekend. Thank you so much for your time, and we look forward to the upcoming webinars and an equally good attendance in the next series. But thank you so much, everybody. Have a great day.
Yeah,
thanks,
Madhur.
Thank you, everyone.
And
Thanks,
Anjanda.
everyone.
And all
Thank
the
you,
panelists.
Meena. Thank you.
It's a pleasure.
Thank you.
Bye.
Bye-bye.
Thank you. Bye.